Thank you, Madam Deputy Speaker. I made my maiden speech in the last Queen's Speech debate on health when you were also in the chair, so it's a pleasure to speak in this one. And I welcome the commitment to bring forward proposals on social care reform. COVID has underlined the long-standing issues facing the sector, and in our recent report, the Public Accounts Committee highlighted that among the challenges to be addressed are funding, workforce and the future accommodation model. Importantly, the plan needs to focus on younger adults with learning and physical disabilities and mental health issues, as well, of course, as elderly people. It should also support the essential role that unpaid carers, like those I've met in North West Norfolk, play in looking after their family and friends. As well as tackling social care, the Queen's Speech pledged to increase investment in the NHS, and my constituents are particularly focused on the new hospital building programme. As one of the best buy hospitals, the Queen Elizabeth in King's Lynn was built with a life expectancy of 30 years. Now in its 41st year, QEH is in need of urgent modernisation due to major structural issues with concrete planks in the roof. The Expert Committee on Structural Safety first issued an alert regarding these rack planks 2 years ago, and currently there are 194 props across 43 areas of the hospital supporting the roof. The Trust's risk register has a red rating for, and I quote, a direct risk to life and safety of patients, visitors and staff due to the potential of catastrophic failure of the roof structure due to structural deficiencies. Aside from the safety concerns which the Trust is managing, the props create a poor experience for patients and the hard-working staff in the hospital. Now, Madam Deputy Speaker, I welcome the recognition of the seriousness of the situation by the Secretary of State and my honourable friend the Minister, and the £20 million of new funding QEH has received this year will help deal with the most immediate issues. However, the need is greater, and this is literally money to prop up the roof. As the Secretary of State said last week, you get to a point with a piece of infrastructure where continuing to just keep propping it up gets to the end of its usefulness and you need to do something completely new. I agree, and we've reached that point with the QEH. The Trust estimates it will cost £550 million over the next decade just to manage the risks, not to improve the situation. In contrast, it's developed a strong case for investment to transform the hospital to meet modern healthcare requirements, to deliver healthier lives, harness innovation and technology, and all at far better value for money. Other best buy hospitals are on the list of new hospitals, and the QEH is a compelling case to be one of the 8 additional schemes that the Prime Minister has committed to. So I'd be grateful if my honourable friend could update the House on when the selection criteria for those schemes will be issued. And I reiterate the invitation to my honourable friend, the Secretary of State, to come to QEH to see the situation for himself. The need is obvious. Patients and 4,000 members of staff need a hospital that's fit for purpose. Thousands of people locally have signed a petition in support. Local council leaders are supportive. And with significant housing growth planned in the area, demand for healthcare is only going to increase. So I urge the Government to back our bid to deliver the hospital that patients and staff deserve.